Go.
Hi everybody, it's Dr. Mark Cloth here from Dentistry on Sheppard. We just want to shoot a small short video to explain to everybody what to expect when they come for a dental visit at our office. The day before the appointment, we're going to either call, text, or email you, and we're going to ask you a series of questions. It's a screening questions to make sure that you're healthy so that you can proceed to your dental appointment. We don't want to bring any viruses, any possibility of COVID-19 into the office to keep everybody safe and healthy. Once you pass the screening questionnaire the day before, we're going to ask you to proceed to your appointment the following day. And once you get here, we're going to ask you to text us either if you're waiting outside, if you come by foot or by public transit, or if you're in your car, we're going to ask you to text us when you've arrived. Once you text us, then we'll text you back as to when to proceed to the office. This is important. We don't want anybody milling around in the office and hanging out more than they have to. So once you've arrived, you're going to come to the door. You're going to bring your own mask, or we're going to give you a mask. Okay? You're going to come into our receiving station. We're going to give you a mask if you don't have one. Okay? We're going to ask you to use alcohol-based hand sanitizer. And we're going to ask you the screening questions again. Okay? These screening questions involve: have you been in close contact with anyone with acute respiratory illness or traveled outside of Ontario in the last 14 days? Have you had a confirmed case of COVID-19 or had close contact with anyone with COVID-19? Do you have any of the following symptoms: fever, cough, difficulty breathing? People are familiar with these symptoms. We're going to ask you to use the alcohol-based hand sanitizer. And we're going to take your temperature. Make sure you're not ill, okay? This is a no-touch thermometer. I passed, 35.5. Okay? And we're also going to ask you for your consent, okay, to do dentistry during these COVID-19 times. We're going to ask you to sign that. And then we're going to proceed into the office itself, okay? Hopefully you're going to pass right by this area and go right into the operatories. So come on in. As you can see, we've installed some new glass doors with our logo to contain any aerosol and to allow everybody to be safe and healthy, and they look good too. So come on in, past our new glass doors. You're gonna come in, and you can see right away our new Austin Air hospital grade HEPA disinfecting filters. So these help to clean the air, to keep everybody safe and healthy. All the while now, you're going to be wearing a mask. Once you sit in the chair, then we're going to ask you to take off your mask and rinse with a hydrogen peroxide rinse. This decreases bacterial and viral counts in your mouth. Okay? After you do your rinse, then we are going to do the treatment. The dentistry begins. After the dentistry treatment, either the scaling that you're going to have with a hygienist or fillings, crowns, what have you, with me, then we're going to ask you to put back on your mask, okay? And come on up to the front. You're probably going to notice that we're going to be wearing more PPE. Everybody's familiar with the PPE, personal protective equipment. The hygienists are wearing gowns. We're all wearing some version of K95 or N95 masks. We're all wearing goggles and we're all wearing face shields. And that's just to protect us and also to protect the patient. It's a mutual thing. You're going to see more PPE on us. Come on up front. So after the appointment, you're going to proceed right up to the front. And at the front, you'll notice our new acrylic barrier to keep any droplet spray away from our fine receptionists, Hannah and Marianne. And you're going to proceed to do any paperwork. This paperwork can be done remotely. If you like to just leave, we can probably proceed and do any financial transactions and any paperwork remotely if you prefer. We're going to do this quickly so that you're not lingering around the office, and then you're going to be free to go. Thank you. Thank you for listening to us, and thank you for listening to this video.